Thank you for the kind invitation. It's an honor to be with you here this morning. It's not my role to overwhelm you with information or to lay out my 20-point plan on how to resolve all of the issues of the Oregon healthcare system. First of all, we don't have that kind of time on the agenda. Secondly, I don't speak that fast. And thirdly, a plan like that really takes all of us. I will, however, as one who has spent the last 27 years working in community health, share with you a few thoughts. There is a core, fundamental driving value that drives the work of Virginia Garcia. And it's an idea that I know that you share with us. And that is that our own health and the health of our community really is tied to all having access to care and having the opportunities for living a healthy and prosperous life. We are all in this together. Now, oftentimes, it's a personal story or a tragedy that can move a community to act. Such was the case with the story of Virginia Garcia, whose death cast light on the barriers to access for farm worker populations in Washington County. But who, we may ask, are the Virginia Garcias of today? Who are those people who face those barriers to care? Is it the man struggling with mental health and addictions issue, living in our parks? Is it the refugee traumatized by war and violence? Is it the family living in their car? And what are those intolerable conditions to which we are becoming immune? Do we have generations of kids growing up thinking that campsites along the side of the highway or people looking for handouts at the exits is normal? How can we ensure that all people have access to affordable care regardless of their background? In the case of Virginia Garcia, it took community leaders who stood up and said, we can do better. We must do better. From that resolve, from that conviction, was born the first Virginia Garcia clinic in a 3-car garage. And some 43 years later, we are serving more than 45,000 patients across Washington and Yamhill counties, serving people in many different languages. We've evolved a model of care which is patient-centered and culturally appropriate and team-based. For example, at our McMinnville clinic, we have a team that is really focused on helping their patients manage their diabetes and hypertension. They're employing a warm handoff model of care, whereby the provider will introduce the patient to the registered nurse, who can then follow up with ongoing education, counseling, and even troubleshoot things like transportation to the office visits or to referrals. Jen Kelso, the nurse on that team, really credits the personal connections between the patient and the care team for their success in helping their patients meet and manage their diabetes goals. But we know that access for all does not mean one size fits all. Population health requires that we understand the unique needs of the individual patients. Yolanda is a 42-year-old mom whose condition results in her blood pressure skyrocketing. After she was hospitalized and she returned home, we sent a transitions of care team to her home so they could work with her, an occupational therapist and social worker, and they looked through her kitchen cabinets and identified those high salt foods. And together they were able to work on developing a low sodium diet. Now that transitions of care team has done remarkable work in reducing the readmission rates of our patients to the hospital, saving thousands of dollars to the system. And Oregon has come a long way. In many respects, Oregon is leading the nation. I'm so proud when I can speak to my colleagues in other states, and sometimes I feel bad for them, when I'm talking to people from Oklahoma or from Idaho even. And I share with them all the innovative work that Oregon is doing, that we've been able to cover nearly 95% of our patient population, that we have developed coordinated care organizations that are combining physical, mental health, and oral health to best manage the population, to align providers and health systems around quality metrics. It's been transformative. Alternative payment methodologies that are rewarding value and outcomes over mere volume of more procedures and visits. So we have a lot to be proud of, but Oregon still faces many challenges. The last United Health Foundation's rankings of states, the healthy states across the country, puts Oregon at number 20. So we're between Massachusetts as first and Mississippi as number 50. Because we have some very tenacious issues, stubborn issues that we're facing around health disparities, health equities. Too often our zip codes and our census tracts are predictors of our health outcomes or our educational attainment. We have still chronic conditions of obesity, diabetes, hypertension that are an increasing burden to individuals and families. So now is not the time for Oregon to rest on its laurels with the impressive accomplishments that we've made. Now's not the time to slide back into those short-sighted formulas of cutting benefits or eligibility, because Oregon has set its course on ensuring access for all in our community, for those who are most vulnerable, but equally for all of us. As Dr. King reminded us, none of us are free unless we are all free. We don't need just little pockets of health. We need healthy communities across the entire state. But healthcare providers can't do it alone. Neither can government. We need all sectors of our economy, of our society to come together to help raise us to the next level. We need the leaders in this room, and we need those leaders back in our community to join together in, like those leaders of Virginia Garcia before, who stood up and said, we can do better. We can roll up our sleeves. Now is the time. Now is the time for us to draw upon that creativity, the innovation that Oregon is known for, that have guided us in our transformation journey. We can be like those leaders of Virginia Garcia before, who turned the tragedy of the death of a little girl into the hope of a healthy tomorrow. And so, with that, together, we can do better. Thank you very much. And I want to invite you to continue dialogue on how we can make our communities the healthiest place by joining us in a workshop this afternoon on exploring place-based models for community transformation. Thank you again.